I'm Dr. Neneman with Neneman Chiropractic, and thanks for joining us again this week for our week 2 of our video blog series. What we're going to talk about this week is a continuation of what we talked about last week. Last week we talked about joint dysfunction and how it relates to osteoarthritis. This week we're going to talk about arm and leg nerve pain and how that stems from osteoarthritis. Last week we talked about how the joint and the disc, how that's all involved. Well, this week we want to center in more on the nerves. The spine itself protects the spinal cord and the skull protects the brain. So obviously the spine and the skull have very important functions. They protect your spinal cord and your brain, which make up the nervous system. The nervous system controls everything in the body. So your heart beating, your lungs breathing, everything in your body is controlled by the nervous system. Your brain and your spinal cord are relaying messages telling your body to carry out its functions. So obviously the nerves have a very important function in the body. Now last week we talked about osteoarthritis. We talked about how the disc wears down, bone spurs develop, and that creates less joint space, less space for the spine to move. Well, if we look at this little model here, this is the spine. There's 3 vertebrae here in this model. But at each level, at each vertebral level, you have nerves exiting the spine on the left and the right side of the spine. You have 24 vertebrae in the spine, so you literally have nerves down the right side of the spine, down the left side, exiting at every single level. These nerves go to organs, they go to muscles, they go to every other item in the body that carries out a function. So that's where taking care of your spine also comes into play, because if you're having joint dysfunction, it can put pressure on a nerve, and wherever that nerve goes, whether it be an organ, a muscle, that end organ or muscle won't be working properly. So that's why another reason why getting adjusted is so important, because it's going to allow those nerves to function at 100%. But back to what we were originally talking about with degeneration or osteoarthritis. When those vertebrae develop bone spurs and that disc in between wears down and those vertebrae approximate, it creates less space for these nerves to function. Literally the oval space around the nerve closes down, and it creates pressure on those nerves. So not only does the nerve have less space, but that disc could be bulging and putting pressure on it. Inflammatory fluid around the nerve could be putting pressure on it. And when that nerve, wherever it ends up going, it can cause problems. Now specifically today we're going to talk about nerve pain in the arm and nerve pain in the legs. So if there's people out there, they're having numbness down their arm and they don't know why, they can't figure it out. Well, all the nerves in the lower neck, they stem out of the neck and come down towards the shoulder, and they form what's called the brachial plexus. The brachial plexus is like a big web of nerves coming off the neck, and they go down the arm. And so sometimes when a patient's getting numbness down an arm, it's actually because that nerve up towards the neck is being irritated or compressed, and it's causing that numbness or tingling down the arm. So this can indicate a significant problem. If that numbness or tingling in the arm is left untreated for a long period of time, you can actually start getting permanent nerve damage. So if you're starting to experience this, it's good to go see your chiropractor. Get evaluated, get x-rayed. You can see, okay, are you having arthritis? Is that nerve being compressed? The same goes for the lower back. Again, if that nerve has less space due to degeneration, or because the disc is hitting it, or because there's swelling around the nerve, that nerve, actually, it's a series of nerve roots in the lower back, again, that branch out the spine, and they're like a web of nerves, and those web of nerves come together to form one solid big nerve, which you've probably heard of, called the sciatic nerve. You have one on your left side, one on your right side. It comes off those web of nerves, runs through the glute, like through your glute muscles, through another muscle called the piriformis, and it runs all the way down the leg. And as it goes down the leg, it has more branches that go all the way down your calf muscle, into your foot, into your toes. So there's also people out there that we see that have tingling or numbness down their leg, whether it be down the back of their thigh or all the way to the foot or the toes. Again, this can be an indicator that you are having nerve compression due to osteoarthritis or disc bulging, or fluid around the nerve, or just simply fixation or misalignment. Now, I will say there are instances where I have patients all the time say, well, I wake up in the middle of the night, my arm's numb. Well, there's instances like that where you don't have a nerve problem, you don't have a nerve problem or degeneration, but maybe you're just sleeping and compressing the nerve in your arm. That's common, that happens. So if you're getting numbness tingling strictly at night, it might not be a serious problem. You could just simply be laying on the nerve. Same thing, like as an example, if a guy is sitting on their wallet, which you shouldn't do, that wallet can actually dig in and hit that sciatic nerve in your glute muscles, and that simply could be causing the numbness you feel down your leg. If you take that wallet out of there, it might go away. That's just directly compressing the nerve with an object. But again, if you are wondering if it could be something serious, you need to come see your chiropractor and get it checked out. Because again, left untreated over a period of time, it can cause permanent nerve damage. One of the things that can happen is wherever that nerve goes, again, it could be the calf or it could be the arm, the fingers, it can actually start creating muscle weakness, because again, that nerve controls the muscles. If that nerve's being permanently damaged, it'll create weakness to where that muscle doesn't function properly. So, definitely consider getting it checked, so we can evaluate to see if you're having arthritis, if it's causing the nerve problem that you're experiencing. So hopefully this helps you understand more the role of the nerves in the body, specifically down the arm, down the legs, what we kind of focused on today. So hopefully this was informative for you again. Join us next week. We will have another topic to go over with you guys. Hope you have a wonderful week, and we'll see you next week.